Hey everybody, welcome to Investing in Your Health. My name's Chris Steele, and we're going to be talking about investing in your biggest asset, which is your health. Our expert guest today is Dr. Lesley Milton. She's a pediatric dentist and owner of Tooth Be Told Dentistry. And before we get started, I want to thank First Community Bank for giving us the opportunity to talk to you guys today. Just a little about our expert today. Dr. Milton trained in dentistry in Geisinger Institution, which is in Pennsylvania, very close to where I trained in anesthesia, and so we're kind of close there. She was a graduate of Lyon College in Batesville, Arkansas, and also did a fellowship in pediatric dentistry. So she's been running her own practice very successfully in Batesville now for a few years, and doing an awesome job here. So what's the difference between a pediatric dentist and a traditional dentist that we hear about?
Okay, so a pediatric dentist is essentially, it's equivalent to the pediatrician of dentistry. So you complete 4 years of general dental training. After that, a pediatric dentist goes on to 2 additional years. This is really, the time that we focus on infant care, all the way children's to adolescents and special healthcare needs. And then also we get 2 intense years of hospital dentistry, sedation dentistry, orthodontics, trauma cases. I still have nightmares of my beeper going off in the middle of the night, dental trauma cases. So it's just two more years of advanced training handling pediatrics.
A lot of people are home more, obviously, with a lot of people working from home, a lot of kids out of school. What are some things people can do for their basic dentistry needs during the day, since they have a little bit more time at home?
So a couple things. Dental cavities, caries is the most common chronic childhood disease. So it's 5 times more common than asthma and 7 times more common than hay fever.
Wow.
So not getting out of the routine of brushing, you really need to be brushing twice a day, flossing once daily. Another thing with the kids being home, limiting the sugary drinks and snacks, trying to limit those. I know the kids are home, they're getting restless, that's all they want to do is drink juice and soda all throughout the day.
And by limiting, do you mean have at least 1 hour where they're not drinking juice and eating snacks? Is that the limit you're referring to?
Maybe more than 1 hour.
More than 1 hour, okay. I'll have to tell my kids.
It's all about frequency. So the American Academy of Pediatric Dentistry, they recommend, so the amount of juice that a child should get, less than 1 year, there's no nutritional value to that. So not sending your kid at that age to bed with juice. And then 1 to 3, the recommendation is 4 ounces. So that's a day. So,
and a lot of kids, small juice boxes?
One of those small juice boxes. But we say having it all at one time versus waking up at 7 o'clock in the morning and drinking it all through the day. It takes your mouth about 30 minutes to recover every time you drink something sugary or acidic. So as you can imagine, if a child is drinking all through the day, they're much more likely to have, be prone to the cavity process speeding up or developing a cavity.
So don't have them nurse their drink the whole day. If they're going to drink juice, have them drink it and be done with it.
And be done with it. So I always tell all the parents and families that come in, have it at meal or snack time. Now the sugary snacks or carbohydrates that we're having in our diet, I always tell parents, the general rule that I follow, if you chew it up and you look in the mirror and it's all in the grooves of your teeth, something like sticky candies or chips, cookies, maybe just brush it out of there so it's not sitting on the teeth all throughout the day. And then at nighttime, when you get ready in your routine to brush, get everything off the teeth and no more juice and no more snacks after that at nighttime. And that can help prevent the cavity process.
That's really helpful. I really appreciate that. Those are definitely things to know. Are there some habits that people get into sometimes while they're at home for adults, perhaps? I know those are some tips for kids. Anything adults can
For adults as well, I always, when I'm talking to the parents, equivalent to if you're working a job and say you're drinking a diet soda or a Coke all throughout the day. Much more likely, that acid, that sugar is sitting on your teeth all through the day, so you're speeding up the process of cavities or making yourself more prone. So if you can have it all in one setting, that goes for adults as well. Cokes, juice, And then just drinking more water, plenty of water, and then flossing. Make sure you're flossing once a day. I always tell the kids not the floss dance, the real deal.
Not the dance, but the actual.
The real deal. And that, I mean, that can be translated into, adults helping prevent periodontal gum disease as well.
Okay, as far as health goes for your teeth, are there any diets other than avoiding candy and those kind of things, any nutrients they need to make sure they get in a regular diet?
So I always tell the parents that come in, obviously the candy is probably not the best choice, but anything like nuts, cheese, I always even recommend, a small piece of chocolate. That's much easier to clean off the teeth than, Sour Patch Kids or gummies. And I mean, milk is good, but when you start adding, chocolate milk, Hershey syrup, I like it. But, the more sugar that you add, just on down the line, it increases the chance for cavities.
Makes sense. Well, usually at this point, we have a couple questions from audience members and things like that. I have a personal question that I want to throw in before then, which is we talked about sugary drinks. We didn't talk about coffee, which as an anesthesiologist is near and dear to my heart personally. So from a recommendation standpoint, it does not have any artificial sweetener or sugar, but I'm not going to lie, I pretty much drink it all day. Is that a bad thing, or what are your thoughts on coffee?
Coffee is fine for the teeth. The only thing that you may notice is staining over time. Same thing with tea, which sweet tea does have sugar, but if you're drinking a lot of unsweet tea or coffee, staining is probably the number one side effect that you would get, but it can always be fixed with over-the-counter whitening, Crest white strips, or going to your dentist to have a whitening.
Okay, perfect. Well, that's
You're in the clear.
pretty good news. I'll take it. All right, wonderful. Well, the next question we have is, since you have probably pulled a lot of kids' teeth, what method do you recommend? Well, you want to go with that one?
So we do see that a lot of the times. The kids just have that tooth that's holding on by a thread. They want to get it out on their own. So my recommendation, I see a lot of pulling, we say wiggle. And then we also, if you twist it like a light bulb, so push down and kind of twist. That's the key for the teeth here in front.
Lastly, what's the one best thing that a parent can do for their kids' dental health?
So I think just starting early, developing a dental home is probably the best thing over time. That's going to be the best thing for the child. Now the recommendation is to start seeing the child by first tooth or first birthday. There are some thoughts out there like, man, that's really, really early. But if we can do education and prevention of dental cavities, the sooner the better. I mean, it's developing the relationship with the parent. Sometimes you just don't know. And so just focusing on, setting that dental home up, starting, the oral hygiene, dietary habits early, that goes a long way in life. And just having somewhere to call, especially at age 1, your child's up, moving around. So if they have a dental trauma, you may think, well, what do I do? At least you have a dental home. You can call somebody, call your dentist, and have them come in and help that child. So.
Yeah, that's great. That's great. Well, thanks so much for joining us. It's great to know your office is still open for emergencies and those kind of things to serve the community. That's awesome, and all the things you're doing to keep everybody, your staff and your patients safe. Also love the tips on drinking, not all during the day, but potentially one time. So I think there's a lot of things that our viewers can use in their everyday practice to really help their dental health. So with that, I want to thank you guys for joining us today. Our future guests are going to include focusing on heart health. We're going to talk about pet health, spiritual health, a lot of different options out there. So we're going to be bringing that to you coming up. Again, I want to thank you guys for taking time to invest in your health, and you guys have a good rest of the day. Thanks so much.
Thank you.